So, you've been told that you need a dental implant or dental implants, but you might be wondering, do I really need to have them, and are there any alternatives which may be nearly as good or even better? We're going to look at 4 options today as alternatives to dental implants. Firstly, you could decide to do nothing. Secondly, you could decide to have a denture, and we're going to talk about the different types of dentures and their advantages and disadvantages. Thirdly, you can have a bridge placed as a tooth replacement. There are different types of bridge which we will talk about and their advantages and disadvantages. Finally, you may want to consider having something called smaller diameter implants, and again why they are being increasingly used with cost and time savings, and the procedure is a lot less complex than traditional implants. So, your dentist has told you, or you think you need a dental implant. So, what are the alternatives? You may have been told that, let's assume you haven't lost the tooth yet, so you've been told that you're going to lose a tooth, and therefore in order to replace it you need to have a dental implant. One of the options you should always consider is whether the tooth that you're going to lose can be kept. Now, it may be that, for example, the tooth has a root canal treatment in it already, and the existing root canal filling is failing, or it's got an infection. It may be possible that the old root filling can be taken out and a replacement new root filling can be placed, which removes the infection and allows the tooth to heal back up again. For this, you may need to see a specialist dentist or one in a dental hospital. It's not always worth saving a tooth, but sometimes it can be done. Worst comes to worse, it may even prolong the life of that tooth. So if you think that you're going to lose a tooth, but by having some intervention done now the tooth may last a bit longer, for example another 3 years or 4 years, then it may be worthwhile for you to try to salvage that tooth. But even though you know that it's going to be lost in the long term, you may want to hang on to the tooth for a little bit longer for now. Now, let's assume that you've already lost a tooth and you've been told that you need a dental implant. You could always decide to have nothing or no treatment done whatsoever. The most important factor here will be where the tooth is in relation to your mouth. No one, or not many people, will want to walk around with a big gap on their middle front tooth, because it will just be too noticeable. However, if you have lost a back molar, then nobody really is going to notice that you've got a tooth missing at the back. In addition, it also depends on how many other teeth you've lost. So if you think you're going to lose a few teeth at the back of the mouth, then this could have an impact on the way you eat, and you may not want a big gap or gaps, so you may want to have a dental implant at the back. On the other hand, if you know that you're going to be fairly safe in hanging onto all your back teeth and you're just going to lose a single back tooth, then you may not really want to worry about having a dental implant done. It's always worth considering the option of having nothing done whatsoever. One word of advice is that when you do initially lose a tooth, especially a back tooth, the gap will seem absolutely enormous. It'll be like you've got a big crater left in your mouth. However, rest assured that although initially it will be discerning to have a big gap, after a period of a few weeks or months, you will get used to having a gap there, and if it's not a really big problem for you at that time, you may want to consider having no treatment done. The other way you can think about this is you may not want to have any treatment done because a dental implant may involve surgery that is too complex, or there are risks associated with it. Plus also you have to think about the long-term implications of dental implants. So after some years, a dental implant or any of its components, such as the abutment screw, or the crown or the cap that goes over it, may need replacing. These replacement cycles obviously could be inconvenient, and there is the cost factor to consider as well. You also have to realize that the costs will generally always increase, so an implant replacement 10 years from now could possibly, or will possibly, most likely to cost more than what it is now, although it's not always the case. So the first option is to not have any dental implant done at all, and sometimes it is worth just waiting and to see how much of an impact losing a tooth has actually had compared to initially. So let's look at the second option. This is having a denture. A denture is by far the most commonly used alternative to losing a tooth and the replacement of it. Thousands upon thousands of dentures are made in the UK, so obviously it must be one type of treatment that you should consider, especially as so many people do wear dentures. There will definitely be some people within your family, friends or colleagues who wear a denture and you are not even aware of it. So dentures can be a good alternative way to replace a tooth or teeth, and many patients wear dentures without any problems whatsoever, and they have done for many years. There are, however, certain problems that can arise from dentures. Not everyone can wear a denture because you may find it difficult to get used to, or you just find it intolerable in your mouth having a foreign object. Because that's what a denture essentially is. It is a foreign object in order that replaces something natural that you had in your mouth that has been lost. Having said that, the mouth is, the body as a whole, in fact, is an incredibly adaptive environment, organism, and most patients do get adapted to dentures, even though initially they may struggle quite a bit with keeping the denture in the mouth, with it moving, with the speech, with eating. But most people do manage to wear dentures. In fact, even before bridge work and implant, a denture was the only alternative available to patients to replace a tooth or teeth. There are problems with dentures, and you only know about them once you have had a denture made. I suppose the big advantage of having a denture is that once you have had a denture made and then you find that you can't wear one, you're not really left with a situation worse off than when you first started, because a denture is a removable object in your mouth. There are different types of dentures, and one should always explore the relative merits and disadvantages of each type of denture, and to really gauge which type of denture will be best in your situation. Your dentist may talk about a plastic denture, also called an acrylic denture. This is by far the most common type of denture. There is also something called a cobalt chrome denture. It sounds horrible and complex, but all that means is that the denture framework, instead of being plastic, is made out of a metal called cobalt chrome, and the advantage of it is that a cobalt chrome denture can achieve better retention in circumstances, so it will hold in your mouth better, so it will move less during talking and eating. It will also cover less area in your mouth, which obviously helps in you getting used to a foreign object in your mouth. Finally, they can be made a lot thinner than a plastic type of denture, which needs to have a certain thickness, otherwise a plastic can break. And this is a big advantage of a cobalt chrome denture. A cobalt chrome denture is extremely effective in the right situation, and a cobalt chrome denture can last many years. Not all dentists will do a cobalt chrome denture, and certainly it is unlikely to be available on the NHS, so you would have to pay for it privately. A newer type of denture is flexi denture. There's different names for them. Probably the most common one is Valplast denture, VALPLAST. You can look that up. The flexi type of denture is made out of an acrylic for a plastic, but it's not a hard, stiff plastic. It's got a certain amount of give and flexibility. This allows it to be adapted to the mouth better, and it allows you to get better retention, so it grips in your mouth a lot better, meaning that it will move less and you will get used to it more quickly. A Valplast denture or a flexi denture is more expensive, sometimes 3 or 4 times as more expensive as a normal traditional plastic denture, and it's not available on the NHS, and not every dentist will do a flexi denture, but they can be extremely effective and a good alternative sometimes to replacing a gap or gaps in your mouth once you've lost teeth. These flexible dentures do have disadvantages in that you cannot add any more teeth on in the future. So with a traditional acrylic plastic denture, if you lose a tooth once it's been made, for example in the future, 6 months down the line, a year down the line, a tooth can be added onto your existing denture, which avoids the need for making a brand new denture. But this can't be done with the newer type of flexi dentures, and also it cannot be done with the second type of denture which we talked about, which is the cobalt chrome type of denture. But nevertheless, if you know that you're not going to realistically lose any further teeth in the near future, then a flexi denture is a very, very good alternative to a traditional denture. The other disadvantage that flexi dentures do have is that the plastic does stain a lot more quickly and readily than a traditional denture. The amount of staining that it picks up is related to your habits, such as smoking and the types of food that you eat, so it may not be suitable for everyone. And the problem with the staining is that it just looks not so nice when you take the denture out to clean it, because you just cannot clean the stains out. But really, if that does not bother you that much, then it's not a big thing to worry about. Let's move on to the third alternative replacement. So we've talked about firstly having nothing to replace, missing gap. We talked about dentures and the different types, and the third method is bridge work. These are also called fixed teeth as well. So the main difference between a denture and a bridge is that a denture must be taken out to clean, and a bridge is something that is fixed in your mouth, so it does not need to be taken out. A traditional bridge, however, involves modifying or trimming the adjacent teeth next to where the gap is. This means you are compromising the adjacent teeth to some extent, but this is the only way you're going to get a fixed tooth. It is the adjacent teeth next to the gap that are used to anchor the additional tooth that you want to replace in the gap. The modification itself can have adverse effects on the teeth, on these adjacent teeth. So for example, in a certain percentage of cases the nerve can get damaged, and this can be as much as 20 to 30%. Bridge work also will not last forever, so it will need replacing 10 to 15 years down the line, and when a bridge does get replaced, you will compromise the adjacent teeth further. Having said that, a bridge is still an effective, or can be an effective, alternative to those people who do not want to wear dentures, even though they do have the disadvantages. The traditional type of bridge is just called a fixed bridge. However, the newer, more recent type of bridge is called an adhesive or a Maryland bridge or a Rochette bridge. There's different names. The overall umbrella for this type of bridge is called a minimally invasive bridge, and the advantage is that the adjacent teeth do not need to be trimmed extensively in order to anchor on the teeth that you're replacing. Initially, these bridges were designed as just temporary bridges, but it was found that they were lasting in some patients for quite considerable time, and therefore an idea came into being that perhaps these could be used as permanent bridges in some circumstances. Certainly they can last as long as a traditional bridge. However, they can come off, and they usually come off without warning, so that is something that you do need to consider. So we've talked about having no treatment for missing teeth, dentures, bridge work, and the final thing I mentioned was something called smaller diameter implants. So although effectively these are still implants, they're not traditional implants. The story of smaller diameter implants came about in the USA, where a dentist placed these as temporary implants with a view to replacing them in the near future. But what he found was that the implants had all become firm and stabilized, and they lasted the patient, or as good as any traditional implant. So this is where the idea came about, where this type of implant perhaps could be used as a permanent implant. The advantages are that the procedure for smaller diameter implants is much simpler, is less traumatic, there's less surgery. Most of the time there's no stitches involved or having to take the gum back. Bone grafting is not usually needed, and the procedure is quicker, and there's potentially significant cost savings in this as well. Dentists who have been placing implants for a long time using traditional methods are quite reluctant to place smaller diameter implants, so you may need to search or look for a dentist who does believe in and does place smaller diameter implants. After all, why go for something more complex and more costly when something simpler and easier will do the job just as well, and sometimes even better? there's different names for smaller diameter implants, and they come under different categories such as mini implants, SDIs called, also known as smaller diameter implants, MIDI implants, and there's just lots of different types of smaller diameter implants. But it is something that you should certainly consider before having any type of traditional dental implants done. That's it for today. Thank you.